Welcome to the Outpatient Rehabilitation Care Center, right here at Southeast Georgia Health System. Today we will speak with the director, Paul Trumbull, about the center and about outpatient rehabilitation. Stay tuned, it's all coming up next right here on Golden Isles TV. Hi, welcome back to Golden Isles TV. I'm your host, Avery Brooks, and I'm here with Paul Trumbull. He is the director here at the Rehabilitation Center. Thank you so much for being with us today.
Thank you for having me.
Great. So Paul, tell me about rehabilitation. I know there are lots of different types. We think of like a knee injury or a hip surgery that might need some rehab, but there are lots of different types of rehab that might be needed for different types for each person. Tell me about that.
Well, that's right, Avery. Here at the health system, we employ not only physical therapists, which I think most people think of when they think of rehab, but also occupational therapists and speech-language pathologists. And I think we're the only organization in the Golden Isles that has those three disciplines working together in any one setting. We see patients who have not only those orthopedic injuries that you talked about, but we see a number of people with neurological injuries, perhaps from a stroke or a brain injury. We have a pediatric office upstairs that has all three disciplines as well. We see children with developmental delay, and really anything across the continuum. Patients that come out of the hospital that are debilitated from a long hospital stay, weakened from a disease process. We treat all those folks and do it to the best of our abilities.
Right. Well, it sounds like you basically offer almost everything for everyone. And,
True.
So many different types and a lot of specialists here as well.
That's correct.
Okay, Paul, you just touched a little bit on the variety of physical therapies, speech therapy, occupational therapy. Can you just briefly describe each one for us?
Sure. I think most people understand speech therapy and how they work with speech and language. But speech therapists also work with patients who have cognitive difficulties, perhaps again from a stroke or a brain injury. And they're also experts in swallow. So they work a lot with patients who need treatment for swallow dysfunction or feeding. The cognitive piece that speech-language pathologists do often overlaps quite a bit with what some of our occupational therapists do. So the OTs and the OT assistants work on cognition and problem solving and maybe wayfinding with patients that are having memory problems or comprehension problems. But they also then overlap a little bit with physical therapy. They do activities that are more physical. An occupational therapist will work with patients with what we call activities of daily living, ADLs, we shorten it. And that might be things like getting your bath, getting dressed, feeding, things that you have to do to live your life. And some of those activities include big movements. Some of them include a lot of dexterity. Occupational therapists often are experts in upper extremity because of that fine motor work that they do on a regular basis. Physical therapists I often describe as doing bigger movements, bigger motor activities, standing, walking, getting in and out of bed. But again, there's a lot of overlap with what the physical therapists do and the occupational therapists if you think about those activities of daily living.
Right. So it sounds like really what you're doing here with all the variety of therapies that you offer is really about kind of getting people back on their feet, but it's about functionality, lifestyle, and how they function day to day.
Very much so.
Right.
I think an important part of what we do is that initial interview with a patient. The first time we see them on evaluation day or assessment day, we want to make sure that we're getting at the things that are important to them. What are your goals with this injury? How do you want to get better? What do you want to get back to? So we work with a lot of athletes. We work with golfers and tennis players who want to get back to their sport. Okay. We work with, obviously, people who work in industry, want to get back on the job. And of course, those people that have maybe been more debilitated by one of those terrible diseases that just want to be able to walk again, or get in on a bed again, or be less of a burden on their family or their caregiver.
So anything from perfecting their golf swing to just really functioning day to day.
Absolutely. Yes, ma'am.
So Paul, as you mentioned, lots of different types of people that need rehab. One category would be balance issues. Tell me about a person who might be affected with a balance issue. What underlying condition might they have?
A number of things can affect your balance system, and your balance system is actually fairly complex. Your sense of touch and for instance, you feeling the floor under your feet is an important part of our balance system. But in addition to that, your vision and some other senses that are in our joints and in our extremities that tell us where we are in space or how we're moving. If you shift your weight one direction, there's a very complex system of events going on that tell you you've shifted your weight that direction. So we see people who have maybe a neuropathy, a loss of sensation in their lower extremities. They don't feel the floor as well, or maybe they can't tell where their foot is in space. They obviously are going to have some balance issues. A lot of the work that we do with patients like that is repetitive habituation, getting them used to it, doing activities over and over again. But then, of course, you've got the inner ear, which is the biggest part of our balance system. And there are some techniques that we can use to help people with inner ear dysfunction get back to functioning without losing their balance all the time. The machine behind us, that Proprio 5000, is a machine we use for balance patients all the time. This platform moves in a variety of directions, actually 360 degrees and angles and different speeds. We can challenge people there in a safe environment so that they can go home and do their stairs or navigate the kitchen without falling down.
Excellent. Do you recommend that somebody might try some of these things at home to work on their balance, or is it best to come here?
It depends on where they're at. Obviously, initially we're going to assess their abilities, see how safe they are in this controlled setting. Then we might, hopefully they'll have a caregiver with them or maybe a coach who can tell us how safe they might be at home. Right. And then also assist that person with some activities at home. Generally, we can find some safe things to do at the kitchen counter where you've got something to hold steady onto or holding onto a bar in the bathroom. So we can make it safe and give them activities, home exercise program that they can do safely.
So Paul, we've talked about occupational therapy, physical therapy, speech therapy, but there's actually a new type of treatment or therapy called dry needling. Can you tell me about that? I
can tell you a little bit about it. I'm not the expert, but we have two physical therapists here at Southeast Georgia Health System who are trained and certified in dry needling. Mm-hmm. And you're right, it's a newer technique. It's not something that was around when I went to school. But it's a treatment that is what it sounds like. Long, thin needles are inserted into the skin, into muscle tissue. They're used to treat a variety of musculoskeletal conditions, often pain syndromes, sometimes a person maybe with a mobility restriction. And what we did was we researched dry needling before we really sent anyone out to get trained in it. We wanted to make sure that the evidence supported this technique and that it was something that we felt would benefit our patients. And I guess along the way we found out that it was a very efficacious treatment. We had a staff member come on board who had the training. We sent another one off to some training, and we've had some wonderful results from that.
Great. It's just another great feature of the Rehab Center here at Southeast Georgia Health System. So Paul, when a person does come to you for rehabilitation, does it vary with each patient, or is there a certain prescribed number of weeks? How does that work?
It really varies from person to person. We do our best to individualize the care that we provide. Depending on the issue the person has when they walk in the door and how severe it is and what their goals are, as we talked about before, we will set up a very personalized plan of care at that first visit. Okay. It varies honestly anywhere from a few visits to get an exercise program down that you can take home where you can handle the issue primarily by yourself, to we may see a patient 2 or 3 times a week for several weeks to help them recuperate, rehabilitate after one of those more difficult illnesses or injuries.
Right, so really different for each person.
Absolutely.
So Paul, can you tell me a little bit about the facilities that you offer here, the services and the equipment that you have?
Sure. Today we're in our what we call our main campus outpatient adult rehab facility. In this facility, again, we have all three therapy disciplines: physical therapy, occupational therapy, and speech. So we have a large gym where a lot of the bigger physical therapy activities happen, and we have some private treatment rooms where we can go and have some privacy and maintain confidentiality when we first meet a patient to learn more about them. In addition to that, there are some specialized rooms. And this room is set up more for neurological rehab, the balance that we talked about, and some gait training. But we also have a room down the hall that is it's equipped for hand therapy and for splint making and for some specialized upper extremity activities. In addition to that, a couple of offices down the hall that are specifically designed for speech therapy, where you need some quiet and contained space so those patients can concentrate on what they're doing.
Wow, there's such a variety right here at Southeast Georgia Health System. And there are other facilities as well. I think there's an aquatic.
Well, correct. We have 3 adult outpatient sites. The main campus that I mentioned, we have an office at Summit Medical Plaza, and in that facility, in addition to a nice open therapy gym and a lot of equipment, we have a therapy pool, which is used daily. It's a popular treatment modality for some of our patients and some of our physicians. In addition to that, we also see adults on St. Simon's Island for both physical and occupational therapy. And our partnership with Wolfson Children's Hospital is in the health system's Medical Plaza, and that is a facility where there are Southeast Georgia Health System employed speech, occupational, and physical therapists. In that particular facility, we sublet some of that to specialist physicians who come up from the University of Florida or Nemours to see some of the same kids that we provide therapy to. The pediatric cardiology, pediatric hematology oncology, pediatric ear, nose, and throat are some of the specialties that come up to our clinic on a regular basis there.
Wow, so much is offered. There's such a variety and so many different therapies, and we really appreciate your time today.
It has been my pleasure.
Thank you so much.
Thanks for taking the time to talk with me today.
Thank you.
Mm-hmm.